I would like to call Dr. Asma to the stage. Asma is the Executive Director of Research and Innovation Center in the Department of Health of Abu Dhabi. She's the Executive of Research and Innovation Center, where she has also served as a Director of Health Quality. She has more than 16 years of experience working at the department. She has a bachelor degree in medicine and surgery from UAE University, mashallah, and diploma in the clinical research as well, and a master degree in public health and healthcare and management and leadership. Welcome, Dr. Asma.
A very good morning to you all, and thank you, Salma, and thank you, Dr. Musa, for allowing me this wonderful opportunity. Allow me to provide a bit of a contribution for what we want to do in empowering and enabling women. In a world that changes so quickly, in a world that witnessed the rise and the fall of startups, one might wonder, where is my place? What should I do? How can I be part of the future? And let me tell you, it all starts with you. 4 main questions will guide you. You should ask yourself, what am I good at? What the world needs? And what do I love? And what can bring me money, of course? Taking those 4 principles, the principle of Ikigai, which is the Japanese secret for happiness, will help you find your purpose of life. And similarly, and interestingly, it is applicable to your startup. You have to be aware of the requirement of the world, the mega trends that is happening around you, and what the world needs, and what do you need. Availing the opportunities and envisioning the future from you to your startup to the world. It is very important. In Abu Dhabi healthcare system, the women workforce comprise more than 63%, and that provides an advantage for the women. They are closer to the healthcare needs, and they are closer to the consumer. Today, our contributions to empower, support, and encourage women startup will be by giving you a heads up of what is happening in the healthcare sector domain, not only in Abu Dhabi, but the mega trends that is happening around you. So you have to know the opportunities that is relying here. And you know, in the Department of Health in Abu Dhabi, we believe that a great innovation will not come from big companies. We know and we believe that. It will come from you, from innovators, from startups. Great things will come from those great minds sitting here on the table. Therefore, Abu Dhabi, the Department of Health, have realized this very soon and created an enabling environment to foster, incubate, and accelerate startup companies. Why Abu Dhabi? I would like to share with you a few of the numbers that that will explain to you why Abu Dhabi is a great place to have your startup with. We have, as you know, strong and stable economy. More than 20 billion of foreign direct investment have inflown in Abu Dhabi in the year 2020. We have been ranked among the top global economy, number 30 globally. And our GDP contributions is around 250 billion in 2019, which is even before COVID. During COVID, of course, there is an acceleration, and I'll share that with you. The established infrastructure, as you know, 80% of the world is within 8 hours flight. So you are actually the gateway for the East and West. Our strong relationship and political engagement with a lot of countries makes it easy for you to do business and connecting the West and East. So this is something that is important and very special in Abu Dhabi environment and the UAE. We are the #1 capital in the world that has 100% connectivity of fiber to home connections. More than that, the business friendly, we are ranked number 12 globally and the first in the region for the ease of doing business. And also 100% of foreign ownership across different locations of the world. Again, we are the happiest city. We rank number 1 as the happiest city in the Arab region and the best city for expat to work, number 5 in the world. This is why Abu Dhabi. If we move to the next slide. Our role in supporting the startup is from sitting together to sharing with them the challenges. And there is an important slide that I would like to share. It's a bit complex, but until they close the curtain, it has the funnel. So what do we offer? In the life science domain and health tech startups, what we offer is a full value support from the start of the knowledge development to the business development. Across all that research and innovation funnel, life science, we provide an enabling environment from the basic research to translational research, to clinical, to production, to adoption and scaling. And just to give you, more and in-depth knowledge, what do we mean? It's not things that is written in a nice slide. So if you have an idea, we have a team dedicated to sit with you, develop this idea. We share with you the challenges that we are facing locally and globally. And we develop and support developing the business canvas in order to coach, mentor, train, and also support the establishment of this startup. And not only that, some of the startups that are dedicated toward the healthcare challenges and needs, we do have a waiving by hosting them in our health tech hub in collaboration with Hub 71. We waive the licensing, we provide office space and direct connection and connectivity within our incubators and accelerator that is in partnership with Plug and Play. More to that, if your startup needs an access to the healthcare providers and you want to go and do your proof of concept, the Department of Health is enabling you to do so. And you do your proof of concept directly with the provider, you test your product, you test your solution. If the outcome is appropriate, it's solving the problem that you are having and you have a validated result, then what we do, we believe that your product is very important. We include it in our insurance scheme, which is, as you know, the benefit is managed by the Department of Health, and then you have an immediate commercialization opportunity. We don't need FDA. We don't need EMA. We have the data directly from you. You know that you are saving and helping the problems that you are solving here in healthcare, and this is your immediate first commercialization. In order to do that, also, we open the opportunities for you to grow globally by partnering with big companies, big pharmaceutical and biopharma companies, also with investors. We have a lot of events to expose our local startups toward we export those startups toward potential investors. We have a full ecosystem partners working with us locally, like we have like funds, we have local companies and also external companies. The likelihood of Abu Dhabi Investment Authority, we have Abu Dhabi Investment Office, we have ADQ. All of us is really combined and joining together in order to provide the support for the startups.
Isn't this interesting?
And this is happening.
Abu Dhabi.
So we are actually living the future. I would like to share with you, what do I mean by the ecosystem and the ecosystem partners? So when we talk, it's not the Department of Health alone. It's Abu Dhabi government together. We are the founding partners in terms of the health tech ecosystem and the life science, but we have our strong partners, ecosystem partners, the Department of Economic Development, Mubadala, Abu Dhabi Investment Office, and ADQ. We have anchoring partners, so we have a collaboration with WeWork, Hub 71, Plug and Play. We have international collaboration with the Israeli Innovation Authority, and many, many more international alliances with biopharma and pharmaceutical companies. Our startup portfolio is listed here, and I'm happy to see the first logo. The first, Hasna is the first, I believe, company to join our Health Tech Hub, and she's a strong testimony for how women can develop a successful international startup company. Thank you, Hasna. Wonderful. Thank you. What I want to tell you, this is today. This is living the future of other countries that they are trying now to seek for the future. We're living it. Let me tell you what is our future and where we want you to help us. So what we are doing in Abu Dhabi? Actually, we want Abu Dhabi to be the center for life science. What do we mean by the center of life science? What do you actually want to achieve? We want to be one of the top P20 group in countries globally. What do we mean? So if the startups want business, we are bringing the business to them. We will not tell you go globally and try to seek opportunities. We're actually bringing the big pharma here. We're bringing the factories here. We're bringing all what you need in terms of life science, bio cluster in Abu Dhabi. So perhaps maybe the news, we have covered our trip to the US, where we went to more than 7 life science clusters across the USA. We learned how did it started, and we have the vision of creating this in Abu Dhabi very soon. We have signed more than 7 MOUs with big pharma companies like AstraZeneca, like Pfizer, like, you name it, all the pharma companies. And the purpose of that is 4 principles. First of all, we are going to focus on research and clinical research, because usually this is where the startup of the business is there. And I want to share with you that this is a clinical trial is also applicable for the medtech and biotech. At the same time, we are accelerating the positioning of Abu Dhabi. We are bringing those companies here in Abu Dhabi. More to that, we are going to create the hub in Abu Dhabi. So a lot of those businesses are bringing their offices here in Abu Dhabi, in which it is an excellent opportunity for you to think about the startups. We are embarking on one of the world's largest genomic infrastructure that is happening in the world. More than 1 million genome sample is going to be sequenced. Right now, we have achieved the quarter of that, which is 250 genomic sample have been sequenced, the largest in the world so far. Yani we have reached the target. And do we let it sit in data warehouse? Do we let it sit in computer somewhere? No. Actually, we have deployed it in the patient care. This information have been transformed to the saving, especially the woman, and we have launched the first precision and personalized medicine flagship program in the region. So now with the Cleveland Clinic support, we are delivering precision and personalized medicine. This is data, this is information. And the room is huge for you to take those information, develop your startup, your digital startups, create the digital twin, bring those innovative ideas, because the deployment is going to happen now, not in the future. The deployment is happening now. We are working with Mohammed bin Zayed University for AI. We are working with the University of New York University, with Khalifa University, to bring those creative ideas to help us solve the problem of our patient. And you know what we are embarking on it right now, and this is perhaps maybe, again, the aspiration of the world is we are moving toward a courageous system. You know, breast cancer is a problem, especially for women. And sometimes, especially here in the region, the detection comes in a very late stage. That is a problem. So right now, with the Emirati Genome Program, and the data is there, that we are able to know this way, way, way ahead before even the cancer develops. The gene markers for cancer can be detected and is known. So Why aren't we using this? We are embarking on establishing the preventive precision medicine for breast cancer. So ladies from the age of 30, they will be given the option, do I need to know, do I have a chance of developing breast cancer, yes or no? You have the right to know. You will be given the information. Not only that, it's not about information, it's about the proper treatment and management and care from A to Z. So you will be given the support, the social counseling, all the information. And you know that already a drug has been discovered to reduce the chances of women developing breast cancer from 60% to 2%. So if you take this pill, you're free from all the headaches and all the worry. You don't need to do mammogram every year or as you grow, in a healthy life. We are doing this now. Startup companies, we need you. We need you to join us in this journey. What we need is for you to look at this mega infrastructure that is available in the Emirates of Abu Dhabi. As you know, Malafi, 100% connectivity. So what we call as a phenotype or the medical records or the information is readily available across the whole UAE. And now we are putting this genetic information. You know, what we know about the gene is just like that, by the way. And the rest of the gene is not yet discovered. This is a green ground. This is a blue ocean for you to navigate and think about. Our focus is not only healthcare. Our focus is life science, biotech, medtech, innovation, digital, everything that you can name it. And the potential is huge. We are riding the wave of the future. We are not just following, we are moving forward. And this is the expectation from you. The women, honestly, it compromised perhaps maybe more than 60% of our health tech startups do have the huge potential of knowing exactly what is needed from the years of experience. And you have the bright mind and thinking toward how you can contribute, supporting and availing actually the benefit and the infrastructure in Abu Dhabi today. You have a huge incentive packages from our ecosystem partners, but we need that kind of a spark of the thinking, and we will help you across the way. When COVID hits, we created an alliance to fight COVID, and the startup rose up to those challenges. And the startups were the companies that helped us deliver medication to the patient house without really leaving their home. Startups helped us creating the telecounseling, teleconsultation. They were there. They are agile and able to deliver. And what we are thinking right now is for you to understand the value proposition for Abu Dhabi and benefit that. And this is where it goes back to you. Back to the purpose of your startup. And how will you help be part of this success story? We are building Abu Dhabi to be the life science hub for the region and one of the best in the world. And we are partnering with big companies in order to achieve that. Let us help you. Be part of this picture. Bring your solution to us, and let's embark on this journey together. Thank you very much.
That's amazing. So, audience, if you have any questions, you can raise your hand.
Thank you so much. It was a very valuable talk that you gave. A lot of learning from that, and you were very articulate. I must appreciate that. Regarding your interest and concern with the health sector, more of because you mentioned about the pharmaceutical companies, alliance and everything, it's more towards, I think, large portion towards the physical health. But I wanted to know about the mental health, as I have more concern over the mental health as I'm part of that. And I would like to know what are the chances of digitally coming forward with ideas on mental health issues, because I think more than most of our physical health issues are due to our mental health system as well. Majority of it is due to our mental health system. And I would like to contribute, if possible, towards the mental health, and I want to know what are the chances for that. Yeah.
Thank you very much. We actually don't see the separation between mental health and physical health. Actually, mental health is a very important component of the overall healthcare system. And I believe perhaps maybe 2 or 3 years back, or even more, I forgot, to come the year. Mental health has been raised as a big challenge for the Emirates of Abu Dhabi, and we have, alhamdulillah, good companies that have, startup companies that have really brought interesting solutions to help us toward addressing mental health challenge. We are developing also a new model of care for mental health, where we are moving from sick care towards health care. We are moving from providing the health care in a hospital, in a building, in a setup, towards bringing it to the home care. And this is the transition that is happening right now. And definitely, mental health and support is going to be always required, especially right now when we are embarking on the genomic and the big precision medicine and personalized medicine. A huge portion of this is about counseling, is about translating this information to people and let them know what does it mean. It requires a lot of skills, it's not again a mental health per se, but it's more about coaching, counseling, education, and this is how we envision and we are working toward bringing more of a public health and healthcare towards the home care. Thank you.
There are a lot of youth here is listening to you. So I just want to take this opportunity because you studied from John Hopkins and Harvard Kennedy. I mean, these are the best names. So how they added value in your life, how hard it was just to, encourage our youth for studying more in these names.
Now we are getting personal. I'm very proud that throughout all my education, I have received this education from my country. It is a country's, sponsored. I'm very proud that my first education was from the university, and it was not easy. 8 years, 7 years of hard work and study to get the MD degree. It was not easy, however, and honestly, perhaps maybe I was the only one in the family who chose to be disruptive and move away from the traditional job at that age. I don't want to disclose the year. At that era, that I'm shifting toward medicine, which is totally different at that norm. Alhamdulillah, I was fortunate with the blessing of Allah to be successful in medicine. And the turning point was also toward my employment. I always thought I'm going to join Medicine Sans Frontier and I'm going to save the people and travel all over the world. And I will specialize in pediatrics. But then the first year of internships and employment, I discovered that, yes, I can treat one patient at a time. However, I can treat 1 million at a time. If I shifted toward the public health, so any decision, vaccine, education, awareness, all of this, if I'm able to make a change in that era, then I'm saving millions at a time. And that was very attractive. So although it was, again, at that time, it was believed it is the lowest at the rank of any medical specialization if you went to public health or preventive health at that era. However, me and 3 of my colleagues, one of them is Dr. Farida, as all of you know, we joined the public health. We are the 3 musketeers. We fought. We were the only UAE Emirati national at that, work environment. And then our government was very generous in creating an Abu Dhabi specific leadership program with John Hopkins that is focusing on public health and leadership, the MPH DRPH program. So I was fortunate also with the blessing of Allah to be selected among those 20, doctors. And actually, not all of them are from healthcare. We have people from ADNOC. We have people from different organizations joining together, and we went into the training across, 3 years to gain the MPH. Throughout this, Abu Dhabi government have invested in the Academy for Government Education and Support, and partnered with Harvard Kennedy School. So we have gained a lot of leadership across our growth in the career development. So again, all what I'm saying is that we have what it takes to build the strong leadership. It just, what it needs is your willingness. And you have to bear in mind the road is not always furnished with flowers. It's furnished with challenges. It's furnished with, very difficulties. However, if you know that the answer of those four letters, four questions, lies within you, if you know the passion, and I'll share with you what is my ikigai, helping people. Then if I want to help people, then khalas, that's it. This makes every challenge, every difficulties, when you see the light at the end of the tunnel, you don't see anything else. You enjoy the value. Thank you.
That's amazing. Thank you very much.